Prevention of mother-to-child transmission of HIV and AIDS, PMTCT, is an important concept in reproductive health uh, and care of the newborn, including the mother, and also the strategy that is used in reducing the prevalence and incidence of HIV, especially from the mother to the infant. So in this section, we'll be looking at the methods, ways, strategies under this PMTCT. Amezara Aronyeka. In this section, we'll be looking at introduction, an overview about PMTCT. Then we'll look at key components of PMTCT. Then look at safe delivery practices, monitoring, and follow-up. In the next section we'll now look at full counseling for ART initiation in pregnancy and in breastfeeding. Prevention of mother-to-child transmission, PMTCT, refers to a set of interventions aimed at preventing the transmission of HIV from an HIV-positive mother to her child during pregnancy, childbirth, and breastfeeding. These key periods are very, very important. When the woman is pregnant, during the childbirth, when the baby is being born, and when the baby is being breastfed. These are the critical times that HIV virus from a mother can actually get to the child. So PMCT is actually targeting the period the woman is pregnant, the period of childbirth, and breastfeeding. So this intervention targets this important period. PMTCT is critical for reducing new HIV infections in children and improving maternal health. So in as much as these interventions are looking at prevention of HIV transmission from mother to the baby when the mother is pregnant and then prevention of HIV when the baby is being born, and prevention of HIV to the baby when the baby is being breastfed. It also improves the mother cell. As we're going to see, drugs are prescribed given to the mother. And by that way, the mother's viral load will be reduced. That's why we say it is also important in improving maternal health. Let's look at the global impact of this PMTCT. There have been a lot of successful PMTCT programs, and there are evidence that suggests that is a substantial reduction in HIV transmission rates in several countries where this PMTCT is in place, especially in our own country, Nigeria. Measurement of success often include the percentage of HIV-positive pregnant women receiving ART, antiretroviral therapy, the rate of HIV transmission rate among infants, and overall maternal health. So what we here is talking about, these are parameters that are considered in actually evaluating if the PMTCT program is having good impact or bad impact or no impact. To look at one, what is the percentage of HIV positive pregnant women who are receiving ART? Because let's say in a country where there's about 50 women, and out of that 50 women, 20 is HIV positive. And out of that 20 is HIV positive, only one is receiving ART. That means PMTCT program and therefore it's not having it. But thereby, like 20 women have HIV. Out of that, 20 or 19 are actually on ART. It actually means that the rate of transmission of this virus to the unborn will be reduced. Then the rate of HIV transmission rate among infants, because the total number of women who are positive under ART will definitely determine the rate of HIV transmission to the infant. If the mothers who are HIV positive are actually receiving ART, the rate of transmission of HIV to the infant will be reduced. That is all inclusive, the practices during birth and during breastfeeding. If the PMTCT program is active, the total number of women who will be receiving ART should be high. Then the delivery practices to prevent transmission during childbirth and during breastfeeding will actually reduce the transmission of HIV to the mother, and then the overall maternal health. Because since they are on ART, it actually would reduce their viral load and they will have a better maternal health outcomes. So the WHO and UNICEF have promoted a comprehensive approach to the prevention of mother-to-child transmission of HIV. The approach has 4 major components or prongs, which encompass a broad range of prevention, care, treatment, and support intervention. So PMCTC is actually anchored on 1, prevention. Prevention of the mother getting the HIV. Yes. Prevention of the mother getting the baby getting HIV. Yes. If the mother is actually taking the ARV, the mother will not have the virus. The mother will not transfer the virus to the baby. Then whereby the baby is already exposed, there's treatment given to that baby, then support intervention. So this is the 4 pillars that PMTCT is anchored. The component. 1 is primary prevention of HIV infection among women of childbearing. That is the first component of PMTCT. Primary prevention of HIV infection among women of childbearing age. And how is that ensured? Through health educating these women, health education when they are still adolescent, institution of HIV course in your curriculum as you have been taught in the schools, in primary, in secondary schools, practicing of safer sex, total abstinence, use of condom, and all of that. So if there is primary prevention of HIV infection, the mother's children will not be exposed. Unborn will not be exposed. So the first component is primary prevention of HIV infection among women of childbearing age. And who are women of childbearing age? Women within the age range of 15 to 49 years of age. The second strategy is preventing unintended pregnancies among women living with HIV. Now, let's say a woman finally gets pregnant. A woman finally gets HIV infection. The next strategy to reduce the transmission is to prevent that woman from having unplanned or unintended pregnancies. Because if they have unintended or unplanned pregnancy, they may not be able to come up. And therefore, the PMTCT's intervention will not be given to them because they may not come up, but they didn't plan for it. And when a HIV positive woman have pregnancy that's unintended, that means there will not be all these interventions put in place, and the baby will be exposed. The third strategy is preventing HIV transmission from a woman living with HIV to her infant. And that is where our core concept for today's discussion will be on. Now, this woman is already pregnant and has the HIV. What do we do now to prevent her from giving that HIV to the baby? That's PMTCT. And there's other concept called MCTC, prevention of mother-to-child transmission. So the core pillars is 1, primary prevention of HIV infection among women of childbearing age. 2, preventing unintended pregnancies among those who are already having HIV. Then preventing HIV transmission from those who already have HIV and are pregnant to their infant. And lastly, providing appropriate treatment and care and support to the mothers who are already living with HIV and their children and families. These mothers are actually HIV positive and their children are HIV positive. We need to provide appropriate treatment, care, support to this. So these are the strategies for prevention of HIV transmission. Now let's look at key component of PMTCT. The one we look at is the component for prevention of HIV. But here now we're going to look at the core components, of PMTCT. One is initiation of lifelong antiretroviral therapy for HIV positive pregnant women. When the ART is being given, this will help reduce the viral load to undetectable level. You recall when the antiretrovirals are given, they tend to suppress the viral load. And when they suppress the viral load, the chances of transmitting this to the babies are reduced. And also the woman's health tend to what? Improve. So this reduction will help limit the risk of transmitting HIV during pregnancy to the baby and during delivery. So it's recommended that these women should start the ART as soon as they are diagnosed with HIV. Most importantly, when they are pregnant, in order to maximize the protective effects against the transmission. So if these women are actually placed on this, it reduces the chances of the transmission to the babies or to the unborn up to less than 5%. You see, so that is why it is important. So once the woman is diagnosed, the treatment should start immediately. Early initiation of ART for all HIV-infected pregnant women benefits even the mother, like we said, because the mother health will improve and also reduce the risk of transmission in that pregnancy and also future pregnancy. And also, when the baby is being born, it reduces the chances of the baby getting the virus through the breast milk of the mother. And also, if the mother is on that ART drug, it reduces the risk of transmitting that HIV virus to the partner if the partner is negative. So it's the benefit of actually initiating the drug ART once diagnosed is very, very important and key to this PMTCT strategy. So the first key is initiation of lifelong ART for HIV pregnant women, which benefit them, benefit the child, and benefit their husbands. But here we have a challenge. The first challenge is that many women do not come for ANC, antenatal care, for many reasons, such as lack of money, distance to health facility, and all of that, and fear of what is called fear of the unknown. So when they do not come during antenatal and postnatal care, they may not be identified or screened. As such, they continue to transmit that virus to the unborn. And also, most women who attend antenatal services are unaware of the HIV status. Another challenge is when some women are tested, they don't tell their partner, which also affect them because they continue or be religious to this regimen. ART requires support of significant others, your family members, your relatives. So most of them don't tell them. As such, no one is there to help, assist them, remind them of their drugs. And other challenges also is that some women only attend ANC when and as at that time, the virus may have gotten to the baby. Another component is pretext for pregnant women. Sorry, this pretext for pregnant women is still under initiation of ART, because it's when we do pretest that we'll be able to know whether they're HIV. Then we now institute ARV. So it's still under the first component in initiation of ART. So it's always important to educate these women when they come for ANC. You can do that in a group section of people, or not more than 15 at a time. Then it is required of you to at least take up to 20 minutes to explain, to give them the pretext information they need to know. So what are the information you are going to tell us during pre-test before you test them? One, you have to tell them what HIV is, how HIV is being transmitted, and how it can be prevented. You also have to go further to let them know how their babies can get this HIV if they are HIV positive. You also have to let them know that if they are HIV and they do not comply with the strategy of PMTC, that is starting the antiretroviral, that they have about 30 to 40% chances of giving that virus to that innocent baby. Then also let them know during that pretest information that if they subscribe to the directive of the PMTCT strategy, they have about less than 5% chances of transmitting the virus to their baby. These are the information you're going to give to them. You're going to tell them about how HIV is being transmitted and how it can be prevented. You're going to tell them the importance of PMTCT and how it can reduce the chances of the transmission to their baby and how they can increase the chances if they don't subscribe to it. You are going to explain the testing procedure, how you're going to collect their blood through either a